going to start out talking about Erisa Preemption. If you've never heard about it, boy, you're going to hear about it now. But I have to let everybody know. I mean, Karen and I are just barely going to scratch the surface on this. So I'm going to kind of point out how to get more information. To give credit where credit is due, everything I'm going to show you was actually presented in a task force meeting. And it's shown here. This particular task force meeting was on January 6th of this year. And the presentation was by Professor McCuskey and Professor Fuse Brown of University of Massachusetts and Georgia State University. But, you know, they're law professors and I'm not, neither is Karen, as far as I know. So we're going to kind of just try and give you an overview of this, but really there's such a wealth of information available that's coming from the task forces, let alone their subgroups, which are called tags or technical advisory groups. So I wanted to make sure to at least let everybody know that, you know, you have this is public information. You have access. You can pull up these PDFs just as well as I can. If you go to our Mid-Valley website that people put a lot of work into and go to the very bottom of the website, past the donate, don't forget to stop at the donate button. But once you go past the donate button, at the very bottom talks about universal healthcare bills, and then there's a link here for the Senate SB 770 task force. If you click on that, what it'll do is it'll take you to the information on the task force, and then at the very top of that says for updated schedules, rosters, so on, go to OLIS, which is the Oregon you wouldn't think I've lived here for 25 years, the Oregon Legislative Information Service. And if you click on that, that takes you to the Oregon Legislative Information Service website, or OLIS, and specifically the task force. So what comes up right away is an agenda on the left. Don't worry about that right now. That'll just have probably the current agenda. But if you go on the right side, it shows all the meetings. So what I'm going to talk about here, as I said, was from a meeting on January 6th of this year. So, and Karen will be talking about information that was presented at a meeting on January 28th. So for example, if you wanted a copy of what I'm going to be showing you, you could just click on the 1/6/2021, that's the date. And what it'll take you to, it'll show you the agenda. If you look here on these tabs, there's an agenda, meeting materials, recording log. So if you click on meeting materials, what it'll come up with, it'll show you all the material that was presented. So there is some very good stuff in here, like the whole research paper, for example, you can pull up. This is like a 70-page research paper that the professors came up with. And it will show you everything you always wanted to know about federal waivers as it relates to Erisa, but we're afraid to ask. And so it's a great resource. And then if you want to actually view the video presentation, to the right of all these, on the right side where all the meetings are, is a little arrow that says recorded content. If you click on that, you can actually view the whole meeting, including the presentation of the material. So it's a really useful tool to go more in depth. Like I say, we're just barely going to be scratching the surface of this. So let me go back to the presentation. And I hope that's up. Is everybody seeing that now? Good. Okay, so let's dive into this. So what we want to look at is, particularly with regard to funding and participation, is how are we going to get the money that's currently being utilized in healthcare into our single payer plan. So really, we've got all these kind of parts of the pie on the left, and ideally we want to get everything on the left into the single payer plan on the right. And by the way, all this pie chart and all this data is right out of OHA. So we're looking at Oregon, although there's it really tracks pretty closely to nationally as well. Like for example, 51% of all healthcare insurance is employer-sponsored insurance in Oregon, and nationally it's something like 49%. So the numbers are pretty close, Oregon to what national numbers. So in order to get these pie charts over, Karen will be talking about Medicare, Medicaid, and the individual market, which is the Affordable Care Act, kind of how we can get those over and what waivers we need in order to get those over. And a waiver, by the way, if you're not familiar with it, is just really, an exemption. It's kind of a hall pass to get around a regulation. So, but just for example, Medicaid, the state chips in about, maybe 20% of Medicaid money. So 70 to 75% of all that Medicaid money is federal. So in order to bring that over, we need to have a waiver in order to utilize it within the state. So Karen will talk about some of these other pieces. What I want to talk about is how to get this employer piece over. And as you can see, that's the biggest part of the pie is employer-sponsored insurance. So how do we get that over? Well, a certain portion of it, but not the majority of it, is employers that just go out on the market and they'll use United Health or whoever. They'll use established health insurers to cover their employees. But the lion's share of that 51% piece is employers who do what's called self-funded health plans. So basically, in the self-funded plans, they're assuming the risk. There's no health insurer who's looking at loss ratios and so on. The employer is actually taking on the risk. So the issue is, how do we, if we're going to get them into this single payer plan, are there any obstacles to it? And really the biggest obstacle is this thing called Erisa. So Erisa stands for Employee Retirement Income Security Act. And what it is it was a law passed in 1974. Congress basically passed it as a way to regulate and guarantee solvency for pension benefits. So before then, it was employees could raid their pension funds and do all kinds of nasty things to prevent people from being able to have retirement security. So that was really the drive of that law. But unfortunately for us trying to implement healthcare reform, it also covered healthcare benefits. So we call it Erisa Preemption because as part of that law, Erisa preempted any and all state laws that relate to an employee benefit plan. So it doesn't, so it's really saying what states can and cannot do with regard to employee benefits. Now, there's what's called the Savings Clause, which says states may regulate the insurance industry. So states have the ability to regulate insurance, and that includes health insurance. So it basically saves the state's ability to do that, as well as the taxation involved with that. Now here's the deal though, kind of the whammy is this Deemer clause says that states may not regulate self-funded health plans. So now traditionally that was actually a very minor part. I think originally like 7% of employer-sponsored plans were what's called self-funded. But since the Erisa law says hands off, you cannot tell, if an employer is not using an outside insurance agency, you can't tell them what to do with their health benefits as far as how much they cover, who they're cover, whether they cover anybody at all. And the Deemer clause says that, the states, it's completely hands off. So since most employer-sponsored insurance now is covered under that Deemer clause, that's an obstacle to getting that coverage into a single payer plan. So what can we do? Well, one thing, and part of the presentation these law professors gave was one thing you can do is design how to get away from an Erisa challenge. So now right away, again, the federal government says hands off, you cannot mandate what employers do as far as their health plans. So that's out of the question. So, you know, what can you do to get around an Erisa challenge from employers? And they showed several tactics here. These type A, type B, and type C. I don't really want to go into all of them. Really, just go and look at the data is really good. But I just want to talk specifically about type A, the funding, because that's near and dear to my heart. And I've followed all the finance and revenue subgroups, and I'm sure Warren would have a lot to say on this as well. Right, Warren, wherever you are? So funding is one thing I'd like to look at just for right now. So remember, you can't really force an employer mandate. So that's why it shows a check on income tax, because income tax really has nothing to do with forcing whatever an employer does as far as their health insurance. So one way to get around an Erisa challenge would be to completely fund the plan with income tax. Now, if you followed any of the task force meetings or the finance and revenue group meetings, you'd realize that that's a heavy lift, because it would involve a huge increase in income tax. So most plans talking about single payer are also looking at payroll taxes, and that gets a little tricky, because now you have, with a payroll tax, you're kind of taking it right out of employer wages to the employee. And there are considerations where that could or could not be effectively challenged in court. And by the way, that's really the bottom line on this. You think, well, there's got to be some federal regulations that say yay or nay on all this. You're wrong. It's like this big gray area. Really, most of this stuff is determined because it's litigated in court. If you look at the law, that's probably why law professors gave this presentation, right? Because most of what they determined came out of either appeals court or Supreme Court decisions. And that's what really tells people what they can and can't do, which is kind of crazy, but hey, don't shoot the messenger. I'm just telling you how it is. So really the thing to do is you got to try and avoid these court challenges. So for example, Massachusetts had a payroll tax to fund a healthcare proposal, and it was, I think, $300 a month, and it was challenged. There was an Erisa challenge to it, but it was, they succeeded because it wasn't thought to substantially tell an employer, like $300 a month was not substantial enough to influence whether it was putting a mandate on the employer or not. Now, then there was another state, I think it was Maryland. They had a much higher payroll tax, and it was successfully challenged as an Erisa challenge, because with a high enough tax, then you can essentially think, well, it's double taxing the employer, right? Because they're providing benefits and they have to provide this payroll tax. So without going a whole lot more into depth of it, I just wanted to give you a flavor for what's involved. So this is kind of looking at these surviving these Erisa challenges, trying to work around an Erisa challenge. Then so the other thing too is, we talked about waivers. So Karen's going to talk more about federal waivers. So she's going to talk about, on the left-hand side, these different waivers that we would have to get in order to get Medicare dollars, Medicaid dollars, as well as an ACA waiver for the individual market. But again, for the employer market, we really need to either avoid an ERISA challenge or get an actual federal waiver. Now, there have never been any state federal waivers except for Hawaii. And the only reason Hawaii got one for a limited public health legislation was because they passed their law a year before ERISA came into effect. So it was kind of grandfathered in. They let Hawaii in. But there really has been no federal waiver for ERISA. So you can see why this is a very big deal. And that's why we would consider, we would really like to see some kind of federal waiver for ERISA as well as these other waivers. And with that, I'm going to turn it over to Karen to talk about how the other federal waivers would fit in.